Okay, good morning, everyone. We will still have a few people joining, but for those of you who have taken time out of your day to get logged on, we want to make a start on this webinar for you today. So thank you for joining us during your workday for this very important and informative men's health webinar. We're glad to see so many of you find this topic as important as we do here at Safe Hands. So during the month of November, there is a heightened focus on men's health, but the content of this webinar is important all year round. So before we get started with the main content of today's session, and before I hand over to Dr. Hasan, I just want to take a few moments to introduce myself and Safe Hands as a company who are responsible for putting together this session today. So my name's Kerry. I'm one of the wellness experts here at Safe Hands, and I will work alongside a team of qualified nurses and wellness account managers. So Safe Hands is a business offering first aid training and corporate wellness packages, which many of you may be familiar with. And our aim is to work with corporate businesses to improve employees' health and increase engagement with health and wellness activity, which in turn reduces medical insurance claims and supports with staff retention. So we've been in the region for over 12 years now, originally as a high quality first aid provider, and we have expanded into corporate wellness. We're passionate about providing information and care to support the prevention of illnesses. So for any of you who are a client of Benipul, our sister company, you may well be able to take advantage of our wellness packages with Safe Hands on a complimentary basis. So do get in touch with us or your insurance broker if you have any questions about our packages. So on to today's session. So as I mentioned, November is a focus on men's health. And although it is important all year round, we do shine a light on this every year to raise awareness. So if you do have any questions along the way throughout the session, there is a question and answer box at the bottom of your screen. Please feel free to type any of your questions in there, and I'll collate all those throughout the session to present to Dr. Hasan at the end of the webinar. So in today's session, there'll be lots of information regarding statistics, diagnosis and treatment for a range of health conditions. But to allow him to do himself justice, I'm going to hand over to our expert, Dr. Hasan, for his introduction and for today's session. I hope you all enjoy.
Thank you, Kerry and Safe Hands, for the kind invitation. I'll just try to share my So good morning, everyone. Movember, what we call it, it's not November for us. It's actually an annual event involving the growing of mustaches during the month of November. It's to raise the awareness of men's health issues such as prostate cancer, testicular cancers, and other issues. It's actually started in Australia for maybe 6 years ago, and it's an ongoing event every year over all the world. If we're looking at men's health issues by the numbers, we can see that 1 in 3 men has a high blood pressure, 3 out of 4 men are overweight, men are 2 times more likely to drink than women. We said 17 out of 100 men smoke versus 13 out of 100 women. Men die an average of 5 years sooner than women. Almost twice as many men die from ischemic heart diseases, and 9 of 10 top causes of death occur in men, more than in women. And we see cancer is the second common cause in men. If we're looking at a local data from the United Arab Emirates, the number of new cases in 2020, both sexes, all ages, we can see that the most common cancer in the United Arab Emirates is the breast cancer. But if we look at the prostate cancer, which is We had 270 cases, around 5.6%. Actually, it's very low compared to the Western countries, to the European countries. But there is an issue. I think that this number maybe is not reflecting the reality. There is an under-detection of this cancer, and usually when it is detected, then it's detected in late stages. So if we look at the percentage of this cancer in males, the same year, 2020, all ages, we can see the prostate cancer is the second common cancer in males. It's around 270 cases. It's around 12.5% of all cancer cases. So this is why it's important to discover this cancer in time in order to give the best treatment. If we're looking at the screening recommendations, there are a lot of screening recommendations for many issues, both in men and women, for an abdominal aneurysm, for prostate cancer, for colorectal cancer, diabetes, high blood pressure, high cholesterol, and lung cancer. There are different programs, there are different protocols that need to be discussed actually and implemented in different countries and in different healthcare settings. But again, the most important for men's health is the prostate cancer. And if we look at the prostate cancer, prostate cancer is the second, as I said, most frequent cancer diagnosed, and is the fifth leading cause of cancer death in men. I worked in Sweden for 19 years. It was the most common cause of death in Swedish men, 10,000 new cases every year, and almost 25% of them died because of the cancer. If we look across the United Kingdom, prostate cancer is the most commonly diagnosed cancer in the United Kingdom. More than 47,000 men are diagnosed with prostate cancer every year. That's mean 129 men every day. And 1 in 8 men will be diagnosed with the prostate cancer in their lifetime. And there is around 400,000 men living with and after prostate cancer and prostate cancer treatment. So if we are looking at what is the prostate is an organ located in the pelvis between the bladder. This is the bladder and this is the urethra. You can see that the urine passing in the urethra out through this prostate. What is the function of this prostate? The function of the prostate is give the secretion that help the sperms to move and to be alive. Then what is a prostate cancer? If we look, prostate cancer is a malignant tumor of the prostate. That means it's abnormal growth of the cells. If you look here, these are the normal cell pattern of the prostate. And when we have the cancer cells, it's an abnormal growth. It's quickly growth of cells, rapidly growing cells invading the other cells and tissues around. Sometimes the cancer breaks through the membrane, which is called the basement membrane. And when it breaks through the membrane, then the risk of spread is increasing. There are a role of hormones, of course, prostate cancer cell growth, because the growth of the prostate cancer cells is related to the male sex hormones that we call androgens, and testosterone is the most important androgen. Androgens are almost exclusively produced in the testicles, 95% of the testosterone produced in the testicles, and 5% produced from the adrenal gland, which is the gland located above the kidney. So what are the risks for prostate cancer? As we know, age is the most important risk, because the risk of having prostate cancer increase after the age of 50. If you have a family history, you have an increased risk. And what do we mean by a family history? If you have 1 or 2 first-degree relatives develop cancer, maybe before the age of 70, 75, then you have a 10% increased risk of having cancer. African descent, we know that the Afro-American men have developed prostate cancer earlier than white men of an unknown cause, actually, and it's usually more aggressive cancer, and we don't know exactly what is the cause. Smoking and obesity is increasing risk for many cancers, including prostate cancers. So what are the problems diagnosing prostate cancer? The problem is that prostate cancer is generally asymptomatic. It's giving no symptoms at all. In most cases, the symptoms that are caused by prostate enlargement or an infection, when you're feeling that you're peeing more frequently, you're going during the night to pee, you feel that you're not emptying the bladder. The symptoms sometimes may include that, as again, which is difficult to differentiate whether it's enlargement or cancer, but again, the majority of cancers are totally asymptomatic. Urinary frequency, as I said, weak stream of urine, you notice blood in the urine, developing erection problems, incontinence of urine, loss of bowel control, pain in the hip, back, chest, or legs, weak legs. All these may be signs of metastasis of the disease, because again, the prostate cancer in early stages is totally asymptomatic. How can we diagnose prostate cancer? Usually PSA testing, it's a blood test. It's one of the most frequently used tools to give us an idea. Actually, PSA, it's a prostatic specific antigen. It's nothing specific for cancer. It's specific for prostate. But when you have abnormal growth of cells, then the PSA will be high, but it can be affected by other factors. So if the PSA level is too high, this suggests that the cells in the prostate are behaving unusually. As I said, this could be because of a tumor in the prostate, but infection, enlargement of the prostate could be a cause. Digital rectal examination, one of the tools that have been used previously, now maybe not that common used. Put a finger in the back, feel the prostate because it's located just behind the rectum. The problem with a digital rectal examination is the sensitivity. So if you bring 5 people doing prostate examination for the same patient, you may get 5 different ideas or information. So it's not that sensitive, but it may be helpful in the diagnosis. Imaging, doing an ultrasound, doing a CT scan, doing an MRI scan, or doing a PSMA scan are helpful things to diagnose prostate cancer, to stage prostate cancer. But the problem, none of these tools will provide a definitive answer on whether or not you have a prostate cancer. This is why the family history, the history of your diseases, your PSA, your previous PSA examinations, together maybe with radiology, all these things make us suspecting or not that you may have a prostate cancer. This is again about the PSA test and why its results can be confusing, because it's a measure the amount of PSA molecules in the patient's blood. If it is low, it's normal for all men to have some PSA in their blood. If it is high, again, could be a sign of cancer, but could be a sign of urinary tract infections, of prostate stimulation, recent ejaculation, certain medications, vigorous exercises. All these factors can affect the level of PSAs in the blood. Actually, a few words about a new test which we are trying to introduce here in the Middle East. It's called the Stockholm 3 test. It's coming from the same hospital that I worked in Stockholm. This test combined with a PSA test. This test is actually based on about 200 genetic markers, and can be combined with a prostate specific antigen, the PSA test, and we put it in an algorithm to calculate the risk. This test has been tested on around 60,000 Swedish men. It resulted in less need to do an MRI of the prostate, in less prostate biopsies, and in detecting more significant cancer, which is actually this types of cancer that we want to diagnose. So this test will be much more helpful for the PSA test to calculate risk and maybe to decrease the number of unnecessary MRI, unnecessary biopsies, and detecting, of course, more significant cancers. Because sometimes the cancers in the prostate, especially, they are non-significant, and we don't want to discover them because in majority of cases, you don't need to treat them. What is the treatment? The treatment pathway depends on many things, on the tumor characteristics, on your medical history, the age, the kind of treatment available at your hospital, your personal preferences and values, and the support network available to you. So it's always a patient-tailored approach. It's not, one size fits all doesn't exist. Because sometimes it's a multimodal treatment, it's a multi-component treatment, it's a self-management strategies, and then sometimes it's a symptoms-based approach. The treatments, either we do a conservative management. If you find cancer that we think this is a low-risk cancer that will maybe most probably not progress to more aggressive cancer, we usually don't treat them. We just follow them up, and if the tumor progress, then we decide for the treatment. Radical prostatectomy means a surgical treatment, removing the whole prostate and reconnecting the urethra with the bladder neck. We can do radiation therapy by sending radiation to the prostate and adjacent organs, killing the tumor cells, but keeping the prostate in place. And then hormonal treatment, which usually actually cause castration. This hormonal treatment will make the testosterone levels very low. This is what we mean by castration. And if we have low testosterone, then the cancer cells will shrink and will probably die. The problem with hormonal treatment, it's used as a palliative management or as addition management to radiation therapy. And after 2 years, many patients experience resistance to this hormonal therapy. Few words about my specialty or my subspecialty. I'm doing robotic surgery to remove the whole prostate. Robotic surgery has been introduced for almost 20 years ago, and around the world, around 10 million surgeries have been done. We have introduced this surgery at our hospital, City Hospital, since 2 years ago, and doing a lot of prostate surgeries. This surgeries allow, it's a minimal invasive, more precision, less bloodless, speedy recovery after surgery. So this has been a win-win situation for everyone. Again, regarding robotic surgery, it's a better precision, less pain, less bleeding, shorter hospital stay, majority of patients going home the day after surgery compared to 7 days with for the open surgery. It's a lower risk for infection, and of course it's better ergonomics for the surgeon because we are sitting in a console and operating in a comfortable position. So multiple studies highlighted that unless a condition is unbearable, men are up to 50 to 6% less likely to regularly see a doctor compared to women. So we have a problem. Many men, unless the problem is unbearable, they are not going to see the doctor. They are afraid about many things. They are ashamed to go to the urologist to ask things. They are either too busy, afraid to find out something might be seriously wrong. It's a fear of or discomfort of the prostate exam. These are just some of the excuses men commonly report for not visiting a urologist. The question is, can we reduce the risk of developing prostate cancer? Actually, no one knows how to prevent prostate cancer, but staying healthy, a healthy weight may be important, eating healthy, balanced diet, and keeping physically active. Important, again, healthy lifestyle is not specific only for prostate cancer, it's for many other diseases. And as we know, we cannot change our age, our ethnicity, or family history, but we can take control of our diet and weight and our lifestyle. A lot of questions coming about foods can lower your risk for developing prostate cancer. Actually, if you Google it, you find many advices about food, but to be more accurate and more scientific, there is no strong evidence that any individual food can do it. We have some evidence that lycopene, such as in tomato and tomato products, selenium, such as in Brazil nuts, fish, seafood, liver and kidney, vitamin E, all these may, and again may, lower your risk for prostate cancer. But again, there is no strong evidence that any individual food can do it. We cannot prove it. It's very difficult to prove that a specific food can decrease cancer or can lead to improvement in for a specific disease. Of course, when we are speaking about the prostate cancer, we need to know about the prostate enlargement, which is more common condition than the prostate cancer. It's a common condition above the age of 50. It's related to hormonal changes. It can be worrying, but it's important to know that it's not enlargement is not a prostate cancer, and enlargement, it doesn't become a prostate cancer even if it is left untreated. This is a very important to know, that enlargement is not a cancer, and if it is left untreated, it doesn't become a prostate cancer. It's a different condition, and it's mostly, as I said, related to hormonal changes happening after the age of 50. The symptoms of the prostate enlargement, either in the way you hold the urine in the bladder, we call it storage symptoms, or the way that you urinate, we call it the voiding symptoms, or the way how you feel after the urinate, the post-micturition. So you can have different type of symptoms depending on your enlargement. A few words about testicular cancer. Testicular cancer is the second most common cancer in young men, age 18 to 39. So it is very important that any men in this age experience any lump in the testicles, go to your urologist and get it examined. There is no routine screening test for testicular cancer. This is why we need to be aware of any changes and see the doctor if we have any concern. Testicular cancers may, again, cause no symptoms, but the most common symptoms is we have a painless swelling or a lump in the testicles. So whenever a patient, whenever you have, if you yourself or you have any relatives aged between 18 and 39 having a painless swelling or lump in the testicles, so just see your doctor if you have any concern. Get it examined to rule out any cancer. This is an example of an ultrasound, which is the diagnostic tool for the testicle. You see here is the testicle, and here is between these pluses is a lump inside the testicle. And this is usually a testicular cancer. Ultrasound is usually very diagnostic for a testicular cancer, and it's enough to decide treatment. The treatment for testicular cancer, we can do surgery, which is the most important treatment, removing the testicle, giving chemotherapy or radiotherapy, or surveillance. That means just follow up the patient after the surgery. These are the options. Actually, testicular cancer is one of the best cancers that if you have the chance to choose a cancer, because it can be cured up to 99% of the cases. And actually, the introduction of chemotherapy for many years ago was a game changer in the treatment of the testicular cancer, because in the 70s, many of these men died from testicular cancer, and with the introduction of chemotherapy with the surgery, make the cure rate up to 99% in many of the cases. It's important that, like women do breast examination, you can do a testicular self-examination when you're in the shower. So you can cup one testicle at a time using both hands. It's, again, best performed during or after warm bath or shower, because then the testicle will be descended down in the scrotum. Then you examine by rolling the testicles between the thumb and the fingers using slight pressure. You need to familiarize yourself with the spermatic cord and the epididymis. These are tube-like structures that connects on the back side of each testicles. You can feel for lumps, changes in size, or irregularities. And if you again feel anything of concern, or you need to check. So just check with your urologist. Bill Richardson saw that he told us that recognizing and preventing men's health problem is not just a man's issue because of its impacts on wives, mothers, daughters, and sisters. So men's health is like women's health. It's a truly family issue. So this is why important. Men doesn't need to be afraid, to be ashamed of things. If you find something, if you have some concerns, then just visit your urologist, and you will sort out the problem. If this is something you need to worry about, it need to be investigated, or you can get reassurance that this is not dangerous. And this is why the checkup is very important. So again, the most important thing for all of us is to stay healthy. Healthy lifestyles is very important. We know we are all busy, have a lot of things to do, but we need not to forget ourselves. You need to sleep well, you need to quit or stop smoking, you need to move, exercise, and this is the most important thing that we can do for our health, for our families. And thank you very much.
Thank you so much, Dr. Hasan. That was extremely informative, very clear, and I'm sure everyone will agree. We have had a few questions come in, so I'll just pose those to you now. So our first question being, what's the best complete health screening to ensure all organs are healthy and catch any potential long-term health issues early?
This is a very difficult question because, all over the world, the screening have been discussed since many years, and there is no consensus actually about whether to do a full checkup or not. Of course, it depends on different organs, as I can try to show it in the first slides. What are the available screening programs? You can see for prostate cancer, we do the PSA test. Colorectal cancer, some people doing colonoscopy. Diabetes and high blood pressure should be checked maybe regularly with the cholesterol for with the family medicine doctor. And then lung cancer need to be a CT scan. So it's the combination of blood test with radiology, with some invasive methods like the colonoscopy is the way if you want to check, everything is fine and check all type of cancers or health issues.
Okay, thank you, Doctor. So you mentioned when talking about prostate cancer, you mentioned that age is a main factor or the main factor. And what age is that tipping point for increased risk with prostate cancer?
The age above 50. This is why the most recommendation for start screening for prostate cancer is 50 plus. And in some cases, if there is a family risk or if the patient is of African descent, then starting from the age of 45. So it's an aging problem, but 45 for people some have increased risk and 50 so for the normal population.
Okay, thank you. Just having a few more come through as well, Doctor. So somebody's asking, you explained how to do the testicular self-check. Is there a way to perform a prostate self-check?
It's very difficult. I had a patient who did it regularly on himself. You need to put your finger in your back and feel the prostate. It's not easy to do it, but it's feasible.
Okay, thank you. And as mentioned, the age range of 18 to 39 was the high risk age for testicular cancer. Is it just less of a risk after 40? Is that what happens?
Yeah, it's less risk. It's still happening there, but the risk is much less.
Okay, thank you. And another question about prostate cancer. Once the prostate gland is removed completely through operation, can that individual then just live a completely normal life?
The majority living a normal life. Of course, any surgeries may have some side effects like affecting the potency of the patient, but the majority having a normal life after such a surgery.
Okay. And when you were talking about the enlargement of the prostate and that not leading to or meaning prostate cancer, those symptoms, are they similar symptoms that you would find with prostate cancer? So you would go and get both checked out?
Again, as I said, the prostate cancer usually giving no symptoms. So when in the majority of cases, when we have symptoms, it's an enlargement. But of course, whenever we check an enlargement, we try to exclude any possibility of cancer.
Okay, excellent. Thank you. And a final question here. You mentioned a healthy lifestyle is important, talking about sleep, diet, and exercise. Is one of those the most important factor, or is it a combination of doing all of those things?
It's usually the combination of all those things.
Okay, so keep all of those things going.
Yeah.
So I've just had a couple extra comments. Seeing as though we've got a little bit of time, I will put those to you if that's okay. Is there a correlation between testicular and prostate cancer?
There is no correlation between testicular. They are caused by different things.
Excellent, thank you. I think that's quite reassuring for some. And how can someone who has prostate cancer know if the cancer is aggressive or not?
The only way to know the type of cancer is by taking a biopsy, and then we get a grading score from this biopsy. And according to the biopsy, to the PSA together, deciding whether this is a low risk cancer, which is usually slow growing, or maybe more aggressive and need treatment.
Okay, thank you. And somebody's asking a question around castration and what would the impact of that be on their lifestyle?
Of course, castration means very low levels of testosterone. This can lead to many issues. Usually it's something that take few months until happen. For example, the complete or decrease the sex drive, the erections, they get overweighted because of the hormonal imbalance. So it can have many side effects.
Okay, thank you for that. And that's amazing, Dr. Hasan. Thank you so much for answering all those questions so clearly as well. I'm sure everyone will greatly appreciate that. And thank you for such important information delivered so clearly and for going through all of those steps there that an individual might take. So we cannot stress enough the importance of early detection. So we do encourage you to follow Dr. Hasan's steps that he's explained today. And if you do feel that you need any guidance or support based on anything in today's session, you can obviously get in touch with myself, or if you're an existing client, your wellness manager or insurance broker. Equally, a medical professional is obviously the best person to speak to if you do have any concerns based on what you've heard today. But again, Dr. Hasan, thank you so much for your time. For everybody joining, thank you for your time out of your day. We hope you found this session informative, and we wish you all a great rest of the day.
Thank you very much.
Thank you. Bye-bye.
Bye-bye.